Okay, well, thanks for everyone who's joined. It's great to have you here. And for those of you that don't know, I'm Christian Hudson, implementation specialist. So I'm based at the Yorkshire Humber Applied Research Collaboration. I work in the Improvement Academy. And today's about, I'm also in the implementation theme. So that's what today's about. And really, as you know, within the art, we have different themes, but we're sort of uh, in there as well as a kind of theme that works with all the themes. So yeah, so I'm going to talk today about what do we do and how can we help. So really to start with, and for those of you that have seen my talks before, you might see the first few slides you might have seen before, and it's really just, you know, what is implementation research? Why do we need it? What is implementation science? But then the real meat of this is going to be some examples of what we do and what we offer. And then I really want to have some time at the end, and we will do, because it'll only take me about 20 minutes or so, 25 minutes to go through the slides, is actually have a bit of a Q&A session, because the main thing about this really is if we're offering implementation support across the ARC and to the ARC partners, it has to be two-way, and we need to understand what you actually want, what you actually need. So what I'm showing you today is based on the last few years of work from working with people in the ARC. So let me just hide my meeting controls. Here we go. And let's minimize that. Right. So yeah, as a lot of you might know, many implementation efforts fail. So even when we've got highly developed plans for execution, they still fail. And now the thinking around this is one of the thoughts is that it's because of contextual factors, and these can be powerful forces working against implementation in the real world. So whenever you implement something, whether it's in a hospital or a school or somewhere like that, or out in the community, there are lots of things within the context that will impact implementation and almost get in the way of it. So it's really important that our ARC projects and ARC partners and all the work we're doing, that we can learn about implementation so we can overcome implementation challenges together, because we need to understand not just whether things are effective, and that's what we used to do all the time, was effectiveness studies, but we've realized that we also need to understand how to implement and sustain and upscale things, because if we don't do that, we're not going to get impact. And so, quick question: can implementation science help with that? Well, there's lots of definitions, but this is a recent one. And it's saying it's the study of methods to promote the adoption and integration of evidence-based practices, interventions, and policies into routine healthcare, public health settings to improve the impact on population health. So it's about getting people to actually take things up, then getting them into practice, and then keeping them there to get good outcomes and to get an impact. So people can't benefit from things they don't receive. So it's important. So what does it offer? This is another classic slide that I use. Theories, models, and frameworks is probably one of the biggest offerings of the science. So over the last 20 years or so, many implementation scientists have studied very hard implementation and developed different frameworks, theories, and models to really capture that. There was obviously work before 20 years ago, but it's the last 20 years we've really seen all the papers come out and this become a science in its own right. Now, there are different types of theories, models, and frameworks, but there's three really. I mean, your process models, which sort of describe the process of implementation and how to translate research into practice. Then you've got a lot of frameworks that tell us what are the things that impact implementation, and then we have things we can use to evaluate it. The other thing the science has tried to do for a long time is look at testing out implementation strategies. So I think we know that there's good ways to do things and not very good ways to do things. And we've tried to kind of test out those. And I guess a dream has been to find the one strategy that you can apply to any kind of context. So things like training, audit and feedback, organizational changes. And we also have had these kind of implementation outcome measures that we've used to test those against generalizable things like fidelity, reach, feasibility. I'll explain those a bit more in a moment. So that's kind of what it's offered. And let's see that in practice. Now, this is the ERIC list of implementation strategies. So at some point, a group of, in 2015, a group of specialists got together and tried to list all the different types of implementation strategies they could think of. And they put it into this list called ERIC. Now, it's not exhaustive. There's more than this, but it's a good resource if you want to look at implementation strategies. I can't fit it all on one slide, but this is just the beginning. You can see assess for readiness, identify barriers and facilitators, audit and provide feedback, conduct cyclical small tests of change, conduct local needs assessment. So it's not a framework in its own right, but it's something that we can use when we're trying to understand what strategies people are using, or when we're trying to choose a strategy, or we're trying to tailor a strategy to a context. So that's the ERIC framework. And I'm showing you these because I'm going to actually show you in a minute how we use all these in practice and how we could use them to help you. So that's the ERIC list. Let's look at a framework. We are big fans of the Consolidated Framework for Implementation Research. So that's the CIFA framework. CIFA 1 has been around since 2009, and now there's a new one. It came out in 2022. I've had Laura Damschroeder as the author of this. She's an excellent implementation scientist. I have a podcast that she's been on a couple of times. This is CIFA 2, and as you can see, it's got 5 main domains, and it's saying within each of these domains are lots of implementation determinants that can impact implementation. So if you remember those contextual, I was saying how things in the context can get in the way of implementation. Well, these are the sorts of things that can get in the way or support implementation. So your innovation itself will affect implementation. We know that where it's come from will actually affect people's perceptions of it. What's the evidence base like? Is it high quality? Is it good? Is it better than what's already in place? Can teams on the ground adapt it to their contextual needs? Can you trial it, or do you have to implement it everywhere all at once? How complex is it? What's the design like? What's the cost of implementing it? So that's the what. That's the innovation domain. Now, in a setting, why I really like CIFA 2 from CIFA 1, what it's done here, it's started to make people more important. So one thing that's often been lacking in implementation research has been that importance of what we often call soft skills and soft variables like relationships. They're difficult to measure, very difficult to measure, but we're increasingly realizing that they're actually some of the most important variables when it comes to implementation. So, so you've got things like relational connections in the inner setting, which are very, very important. What are the relational connections like within a team, within an organization, or within everybody, involved in that effort there? So very important. Communications, culture. Is there a tension for change? I've been working with the brush team doing looking at toothbrushing in schools, and there's a huge tension for change at the moment. Black kids coming into school with black gums. Oral health is everyone's aware we need to do something about it. So that can drive implementation. There's lots of other ones. I'm not going to go through all of them, but outer setting, things like critical incidents. COVID's one of those. Policies. Again, with the brush team, there's some great policies right now around oral health. So that's really helped. There isn't so much financing, so that's not helped so much. And then the individuals involved, again, CIFA really goes into this more. It brings in a sort of behavioral framework to the COM-B. So you can look at all the different individuals involved in an implementation effort, involved across the system, and see what is their need for this, what is their capability, what is their opportunity, what is their motivation. And then your process domain, what's the team involved in this like? Is there an engagement strategy? Is there a ongoing effort to reflect and evaluate how implementation is going? Are they adapting to the context as it continuously changes and throws up new challenges, which is what it does? So just to give you a little taster of one framework, there's many of them, but this is one, and we can use this with teams to help them understand the context they're implementing into. We can train them to use a framework like this, and we can use this to evaluate how well implementation's gone. So final framework, because I mean, there's 170. So I'm not going to go through all of them, but this is another framework, and I'm sure, like I say, these 3 frameworks we're now going to put together. Now, this one's been around a long time. This is the implementation outcomes framework Proctor and her team put together, and these are useful up to a point because they're generalizable, so you can apply them to any context and any intervention or implementation effort. They're quite useful in that sense. I guess they're limited in other ways, but things like acceptability, so often we find that out just by asking people, is this intervention acceptable? Does it do what it's supposed to do? How have you adopted it or not? How appropriate is it? What's the cost of implementation? the feasibility, and fidelity, it's looking at what we said we would do and then what you actually did. And penetration, how many people could potentially receive this, and how many actually did. And then sustainability. I mean, do people think this is going to be sustained? Will it last a long time? So you get these outcomes, service outcomes, efficiency, safety, effectiveness, equity, and client outcomes. So you can again, we can use these in studies that we do to measure these outcomes. So let's look at an example of an approach that uses all three of these. And this is, so what we're finding recently in implementation research is that case study research is being kind of recognized as a potentially a very good way to research implementation. The traditional randomized controlled trial is great at controlling for internal validity and making sure, actually, our pilots are very good at getting rid of all those nasty contextual problems. But the problem is the results that those sort of studies produce don't really tell anyone in the future how to implement, and aren't very externally valid. So they don't tell us how to upscale and implement this elsewhere. So the thought is that case study approaches are very good for capturing that complexity. And so you're seeing some papers coming out recently about that. And there's even guidelines now. So if you want to do a case study, we can use something like CCC to make sure we're doing a good job. So they enable a dynamic understanding of implementation. They address multiple variables in numerous real-life contexts, and they're great for understanding complexity. And a lot of our projects generally, might have, there'll be a number of sites they're working with, and we can make each of those a case study. So how do we, this is just to give you one kind of study design we might do, and this is a kind of approach we've used with a few projects in the last couple of years. We've got our consolidated framework for implementation research. We've got the CIFA, we've got the ERIC list, and we've got the implementation outcomes framework. The next thing is helping a team understand what kind of data do you need to be collecting, or do you want to collect? What's going to work for you? What's going to work for sites? And what's going to work for the implementation research? So you might have heard of lightning reports. These have been really popular. We kind of brought these in a couple of years ago, and it's a way to really just you might go to a site during an implementation process. So maybe it takes a year or 2 years. That's what the funding covers anyway. We might go and visit them every 6 to 8 weeks, and we fill out lightning reports. So we talk to as many people as we can, but 5 is a good number, and just find out how's it going. What's going well, what isn't going well, any key insights. And we'll actually summarize that on the same day or the day after, and then we'll feed it back to them. So it's just one way of collecting data. It's a rapid, qualitative method of collecting data. Got classic interviews, focus groups we might do with commissioner service users, whoever relevant to the study. Limited documentary analysis. Sometimes we might do that where we're looking at minutes and strategic plans and just trying to see evidence of the implementation and the plan and what's going on. And looking at sustainability. So in this case, I'll put in the PSAT, the Program Sustainability Assessment Tool, which takes about 15 minutes to complete, but it's just a way to ask people about sustainability. And then we've got site process and outcome data. So we always want to, whenever we work with sites, we first start with finding out how do they see implementation as happening? So what's their plan? Do they have a plan? They might not, which is fine. But if they do, what is it? And how are we going to know if we've reached our implementation goals? Maybe it's the number of patients seen or the number of people who's received training. So we need some kind of tangible, outcomes that we can measure. So we can apply all our frameworks to this different types of data, and we've got this outcome data, and so we've got a nice source of data. And so what do we get? We apply these frameworks, and we end up with barriers and facilitators. So the CIFA is very good at telling us actually what went wrong. So we can apply it to these different data sources, to our interviews, to our focus groups, to the lightning reports. And we can really code for the different determinants. So we might find that, relative priority came up a lot. So we might find that the sites found it very hard to keep the implementation of this thing a priority. But then we might also find that sites 1 and 2 had great leadership engagement and sites 3 and 4 didn't. So then you can start to see what the differences are between your case studies. So you're really saying, what is the world that this implementation existing in? What's the context like? What's helping? What's hindering? So that's what we get from a thorough CIFA analysis. We also can look at what strategies sites use to address implementation, and we can use ERIC to help us code for that. We can also, apply the implementation's outcome framework to get things like, do people think it was acceptable? How well was it implemented? Did it have fidelity? What's the penetration? Was it sustained? That sort of thing. So we're really using a multitude of implementation frameworks with multitude of data sources to get a very rich idea of a case study. I'll talk a bit more about that in a little while. So now the cool thing is, what I like about this, we can use things like this. So this is the implementation research logic model. And you think when you've got a project, and usually I'll be training the team to do this or doing it for them or, doing it with them. At the end, they've got to produce the findings. And it's like, if you've got kind of all these different frameworks and all these different data, and how do you put it all together? Well, one thing the science has been pretty good at is helping us with that. So you might make a logic model. Now, I've never been a big fan of logic models because they can be quite reductive, but I found this one, it's pretty good post-implementation. So you can see here, we've put the CIFA findings, that in this case, CIFA findings into this bit here. You've got your 5 domains and your determinants and the main enablers, main barriers, your ERIC analysis with the strategies that, again, you can apply to lightning reports and interviews, goes in here. You've got stuff about the intervention you can put here, and then you've got your outcome data, right? From the outcomes framework, implementation outcomes, service outcomes, patient outcomes. You can have one of these for each case study. And what we can do as a research team or as a collective team is try and understand what were the mechanisms that actually allowed, if these strategies helped, how did they? This is something that's often missing from implementation research. People don't talk about mechanisms a lot, so that's why they put this in here. Now, we might have, say, we've got 4 sites, we've got 4 logic models, and then at the end, we can try and amalgamate and make a final logic model. You'd hope with transportable findings. So I'm not just generalizable, but findings that can be transported from one place to the next. Because the real key that we're trying to solve, the real problem we're trying to solve is how to actually help sites implement going forward. We don't just want to know what happened in this place with this context. We want to know how we can help. So yeah, we might make a final logic model. And again, we can help you do this. Just another way of analyzing the context, or at least showing it. This is a CIFA analysis. That's actually CIFA 1.0. This is something I did recently, and it just gives you like a kind of flavor really of what's the context is like, what's helping, what's hindering. Anything with 2 pluses is a strong facilitator. Anything with 2 minuses is a negative, is a strong barrier. So you can see in the outer setting, we've got like policy is good, is helping, but financing and external events is a problem. People think that it's pretty good intervention. They can adapt it, they can trial it, but it's a little bit complex. In a setting, it's compatible, so it works, it fits into workflows quite well, but it's not been kept a priority. So you can see how we're getting an idea of the landscape with this kind of analysis. And what you can do with these, also with these case studies, with this kind of CIFA analysis, you can also make themes, which I find a lot of research teams like because they're used to doing that, right? So this is just to give you an idea of this. This is an analysis I did not so long ago. And really what we found was that the intervention was favorable to stakeholder needs. People kind of liked it, but there were these kind of make or break conditions. So things on the outer setting mostly that could make or break the implementation, but which actually nobody had any control over really. External policy and incentives, needs and resources, external events, financing, tension for change. But let's say those were favorable, then what actually drove the implementation, it seemed to be this kind of engagement really, and the collective and individual efforts of key people. So partnerships and connections were vital. So, people connecting, commissioners connecting with practitioners and providers and parents, but also these key people like opinion leaders, that have a sway over what everyone else does and thinks, or champions or external change agents, these people that go in and kind of really sell the intervention. So it was interesting when you theme it, it can be quite an interesting analysis. So another thing we do, this is recent stuff as well, and this is actually the stuff I get most excited about because I'm always thinking in a kind of meta way about implementation. And Alison Metz, again, a great implementation scientist who I've spoken to a lot, and is implementation research out of step with practice? Now, in my last Lunch and Learn, I really went into detail into this because it seems that a lot of the implementation research we do isn't having an impact on practice, and it does seem to be disconnected from it. So you'll see more papers like this. And so what can we do about that? This is another great one. Frances Rapport and her team. Too much theory and not enough practice. The challenge of implementation science application in healthcare practice. So yeah, what can we do? I mean, I've been thinking about this a lot, and we're really trying to evolve the research actually, and evolve how we do science when it comes to implementation. So one thing we're starting to do is to teach YHARC teams key implementation essentials. We want to help people transform their implementation research so it actually has an impact. So this is just 5 of those key essentials, but things like move beyond problem analysis. So let's not just look at context, produce a list of barriers and facilitators, and then publish the work in a paper. Let's actually try and research not just what the problems were, but the solutions. So that means we have to look at practical knowledge, how to implement. That means generating a different type of knowledge to what a lot of research generates. A lot of research generates generalizable academic findings, not practical how-to knowledge. So it's different. That often means we have to change our role. We have to probably research within, not from outside. So traditional scientific approaches would be, I'm on the outside being objective. I'm not affecting this. I'm going to watch what happens. But actually, the truth is, we're all part of a big system. Researchers are just as much a part of that. Science is just as much a part of that. And when you kind of acknowledge that, okay, we're part of this, then you can start thinking about approaches where action and learning are closely intertwined. So as we might actually influence what happens, we might try and facilitate, and then that will generate the kind of data we actually need because we're learning how to implement. So again, acknowledging the value of alternative roles. I mean, this is just a fact, actually. I think any of you that have done research or worked with researchers, that you don't just extract data. Often, I mean, it does, sometimes that's the case, but often, I mean, a team recently, were having to go and run focus groups, having to make phone calls and make sure people were okay and develop relationships. I mean, it's a very involved role, and some people might even embed themselves in the setting. So the final thing we teach is that if you want to really understand about it, what implementation is and how it can happen, you have to have this kind of processes in place. Like you need some kind of iterative learning processes, cycles of change, cycles of action, cycles of reflection, and improvement science practices are really good for that. And there's the improvement science theme, which are experts in that. And there's the improvement academy, which also, they don't do a lot of research, but they do a lot of kind of getting stuck in and trying to help people improve things. So it's great that we have that at the YHARC, and yeah, we will build this into a lot of our work that we do. So that's something else. I don't want to spend too long on this, but we also do evaluations too. So we see it as an ongoing process of learning throughout. So you can see we're trying to bring in some of these key principles into our evaluations. So when people say implementation is complex, what they're really saying is that it's lots of different things are interacting all the time in ways that are completely unpredictable. And as well as looking at whether you've met your outcomes, you also need to be looking at what outcomes you didn't expect and what you weren't expecting has happened. So context is ever changing, different relationships, different resources, time, knowledge and beliefs, different structural setups, and then you've got your intervention, and then you've got the people involved in implementation, and then you've got the however they're implementing, maybe through training, maybe through improvement methods. But all these 4 big circles are interacting constantly all the time in unpredictable ways. And what we try and do, we try and capture what we call within system learning. So what are these people learning as they try and achieve this goal in this context using this method? And so the lightning reports are really useful because we can collect data constantly instead of just 2 or 3 times a year. We're engaged with these people in an ongoing way. And we're feeding back to them what we find. So we're collecting and summarizing within system learning. We feed that back to them. That feeds back into the implementation effort. They now have a record of what's gone on because most people implementing are too busy to keep a record of what's going on. They're too busy doing the implementation. We keep that, we give that back to them. And that hopefully generates more of that juicy practical implementation knowledge that we actually really need. So that's how we do evaluations. This is a lightning report. This is something else we can teach you to use. And again, another big thing we're very keen on is pragmatic implementation research, because as I say, the 170 frameworks, most people don't have time to learn even one, and there's a steep learning curve for most of them. I do train research teams to use them, but it's a lot of work. It takes months or weeks and weeks, let's say, to really get good at coding with the CIFA or something like MPT or the TDF or the NAS framework or lots of these other frameworks. And it's overwhelming. And if maybe you're a practitioner, actually, you just need some way of collecting data. So this is a great way. Lightning reports, what's gone well, what hasn't gone well, any key insights or learning. And like I say, you can just go and find this out by asking people in the setting and produce a nice summary. It's made to look like this on purpose because you want it to be interesting, and easy to read. It's even got this executive summary for executives who don't have time maybe to read the whole thing. They just want to see how things are going. And this just puts back a bit of intelligence into the process. It gets people to spend time to think about implementation because you're going to ask them about it. And a lot of clinicians, for example, don't have time. Any time away from the patient is often frowned upon, but we're giving them 10 minutes to tell us how it's going and think about implementation. We're feeding that back, and we'll share this with everybody potentially, and at the end we've got a series of lightning reports that capture what's happened. So yeah, they're not difficult and anyone could really use these. So we can also combine implementation science with other disciplines, like I've always said, improvement science, but also co-production, PPIE, anything that the ARC themes are doing, and they're all very good at things. I mean, one of the themes is great at co-production, so we can capture that. Another theme was out in the community, talking to people, connecting people. We can capture that as well. We can learn, is this a good way to implement? So this was just, I've shown this in the last lunch and learn. It's just an example of where we had an improvement specialist who was engaging everybody, who was getting everybody on board, who took them through what they call a test of change. It's just can be 2 hours long or a month long or a week long, but it's to just test this new thing out. Let's see if this intervention is going to work. Let's test it out for a day. If it goes well, then I'll do more tests of change. And so he was doing all this amazing work, improvement work. And what we did was just kind of capture that. Is this a good way to implement this? Is a test of change a good way to implement this intervention? We use lightning reports. We use CIFA. We did interviews. So again, we felt that it really did capture that complexity. It's like, capturing the people, all the people he engaged were using test of change to implement this intervention in this ever-changing context. And it did seem to be a great way to implement. So we're also always evolving. I mean, it's been described as a mutt science before implementation science because it kind of does draw from lots of different places. Implementation science, yeah, but also improvement, also this social science. I'll be talking about this a lot more in the future. It's kind of relational implementation. It's this idea that things like social cohesion, psychological safety, trust actually probably matters more than your implementation strategy. In fact, those should probably be your kind of dependent variables, like the things that we're really measuring. And one thing I know is if I'm going to help a team, or if we're going to work with an ARC project or some people on the ground, if they don't trust us, that's a problem. But also if they don't trust each other, that's also a problem. So one thing that the Improvement Academy is really good at is going into places and actually measuring, is there social cohesion? Do people feel safe to ask a question? So trust is really important. So that's a big thing that we'll be talking about more. And complexity science, which I'm no way an expert on. In fact, I'm not an expert on any of these things. Really, I know the most about implementation science, but I know enough to know that it matters. So, that we, like I said earlier, we need to be looking not just at our expected outcomes, but also our unexpected outcomes from anything that we do, because there will be some. So we're always drawing from different places, and we continue to do that. We're always pushing the approaches that we use, always pressure testing them, trying to improve. So just to finish, this is some of the things we've been working on. Primrose Project is heart disease prevention for people with serious mental illness. We helped them, the team. We did a CIFA analysis, MPT analysis, thematic analysis, lightning reports. I'm very aware that some of you might not be from a research background. I'm really sorry for all the jargon. And if some of you are practitioners, then that's great. That's why I want the Q&A at the end to really find out a bit more about you and how we can help. But so I hope this isn't like, just sorry for all the academic jargon. But toothbrushing programs for children in UK schools. So this is the CIFA, that's the framework I showed at the beginning. We helped them develop a toolkit. Actually, it went live last week. So and that's been really exciting. So we spoke to lots of different stakeholders across the country, from all the way from commissioners to providers, to schools, head teachers, nurseries, to parents, and even some children, to find out as much as we could about implementing toothbrushing programs in these places. And from everything they told us, we developed this toolkit. We've been writing up the CIFA results now, really interesting. And we use this case study approach, and we're going to be using that as well going forward to actually test the toolkit out, see if it's a good way, it's good for implementing with. Unscheduled care coordination hubs. This was a intervention to try and help with the decrease ambulance conveyance rates, so save time on ambulance stop ambulances queuing up outside the hospitals. And again, we helped them do an evaluation of that. We used improvement science, CIFA, and lightning reports. Trauma focused CBT, again, really just help the team design the study, come up with the method, the analysis, train them in using CIFA 2.0, train them in lightning reports. Independent domestic violence advisors, again, very similar kind of approach. And we've also been doing some work looking at research teams on their own and just seeing what's the world they live in. What sort of goals do research teams have or program teams have, and how do they go about meeting those? And by doing that, how do they actually support implementation? And so we did some ERIC coding on that one, CIFA, and a case study approach. So just to finish, we can help you integrate implementation science into your projects. Everything I've shown you, we could help you do. We can help you with designing implementation studies. We're often involved in when people are writing grants and stuff. We'll help them put the implementation in there. And it's always about kind of making it work for you, and so you can achieve your goals, and we can really understand implementation and have an impact. And we can evaluate implementation. We can train your team. So we can train your team in theories, models, frameworks, different approaches, those implementation science essentials, in evaluation, and in these relational implementation things. If you actually want to really, maybe your goal isn't to research implementation, it's to just do implementation well, these things would be very helpful as well. We also, like I say, help you learn how to implement interventions, provide advice, meet funder requirements, because increasing the NIHR wants implementation to be in what we're doing to increase impact. We haven't got a great record of impact really across the ARCs, and we've got a great record of research, but perhaps our impact could be better. So I think that's because the science needs to evolve, as I was saying before. Keep you up to date really just on the latest implementation things. And I do have a podcast. I don't post on it a lot. We don't have much time, but there's some great interviews on there, a few training videos. There's blogs on the Yorkshire Humber ARC website. And now we've got some new advice drop-in sessions. So if after this, you want to come along to that and just ask questions and really go to work on what you're trying to achieve, do come along and I can help with that. So, I mean, we'll share these slides after, but this is a link to the podcast, and this just a nice picture of the drop-in sessions. But we're going to send, I think there's emails already been going around about that. So do come along to those as well. I think it's once every month. And so that's it from me. Has anyone got any questions or want to ask anything or talk about anything? I'll just come out of this. Yeah. If anyone's feeling brave, don't worry. If not, it's fine. Just so you know, we've recorded this and it'll be shared across the ARC. So if there's anyone who couldn't make it today that you think might want to know what we can offer, please do share this with them.
Just say thank you, Christian. It's really fabulous whistle stop tour of all the frameworks, and I feel like I used to be really, really up on implementation science, but I've not had as much dealing in the last probably like 3 years or so. So it was really handy for me. And just on a boring one for me, really, was just the usual sort of question: could we at least get the recommended reading list or something like that? Because I would really like to brush up on it, and obviously appreciate, as an improvement science theme, we do work with you quite a bit and hope to in, you know, YHARC 2 and so on. So that'd be really helpful for me and everyone else,
thanks.
hopefully.
Do you know, I love these sessions because I always learn something too, and I didn't think about a reading list, so I'll definitely put that together. Yeah, absolutely. It's not, yeah, we might also do some training at some point, like yeah, I don't know how long it'll be, but that's another thing. So yeah, but thanks for that. I'll send over the slides and the reading list.
Thank you. Or just the slides if it's too much hassle. Yeah, I don't want to burden you with more work. So.
No, that's all right. Oh, thanks for that, Andrea. Yeah, and Andrea works on in the improvements theme, don't you? So we are very closely intertwined, and we probably should talk more, don't we? But we're so busy, we don't really. But yeah.
But we had that evaluation, in fact, didn't we, for the handheld digital device where we used the CIFA and the proctors, and then we did a bit of compare and contrast as to what we found. That was I remember there being loads of overlap, which was reassuring that the two different frameworks came up with very similar findings. That was good as well. There's probably a paper in there that we haven't written, I guess. You know?
Absolutely. Yeah. I mean, would any of you be willing to put in the chat like what your background is, like what you do? I mean, just so I get an idea about who might what you actually might need from us, and who's interested. See, I've got one from Liz. Thanks, Liz. Thanks, Christian. Great presentation, really informative. I think I need to digest some of the information and support on offer. I'm new to this area. I plan to come to one of the drop-in sessions. Yeah, absolutely, Liz. I know it's overwhelming. You know, there's a lot, and I find that when I did a lunch and learn last month, people said they wished it could have been longer, you know. So this is why I'm thinking about doing more of a longer training, like maybe even a couple of days, and where I can really help people understand how to do implementation research. And then if they want further help after that, you know, we can do that. So yeah. Oh, don't worry. Can't get a camera to work. You guys won't believe this. I had an IKEA delivery during the talk. I hope you didn't hear the guy arrive or anything, but yeah, so you never know what's going on to you in the background. But anyway, well, you all know you've got my email address, I think. Hopefully, if I'll put it in in case you don't, but do get in touch if you need anything, and do come to the drop-in session if you want some help. And you know, we're always here. So it's been great to. I've got a few more comments. Yeah, okay, what Liz says, I'm a new researcher. Yeah, I mean, this is the thing, like you know, I've been doing this a few years now, and people come in and you know, with a lot of experience and a lot of skills, but perhaps they haven't done much implementation research, and they've got the NIHR and people saying, look, we need you to do implementation research, and it's just really overwhelming for people. So that's what I think we can help with the most, is just helping people choose the right framework or frameworks that might be suitable, design the study, help them train the team up so they can analyze. I think in another few years, there'll be a lot more of us that can actually use things like CIFA because we'll all know how to use it. So yeah, I totally get that. Yeah, so for the training, could we bring projects you could help with? Yeah, exactly. I mean, the drop-in sessions are pretty good for that too. I mean, there'll definitely be like Q&As in the training, but if you come to a drop-in session and bring some projects with you, we could start there. And then I think the training, I guess at the end of the training, it would be the goal would be that you've got your design. So yeah, absolutely. I work with Andrew and Emma in the improvement science team. Yeah, great. Thanks. Yeah, cool. Yeah, it is very overwhelming. Yeah, that's the truth. It's complex. So it's like raising a child. I assume you must have children, and it's like you just don't know what's going to happen one day to the next, do you? And it's overwhelming at times. And implementation is the same. It's completely unpredictable. It's like I always say, we usually get my son to eat. You know, one day he's eating really well, and the next day he doesn't want it, or he doesn't want to eat that. He wants different. You know, that is just the way of implementation as well, because you know the context we're implementing into are just throwing up these barriers all the time. So yeah. I've got Lynn.
Yeah, Christian, could I just ask a question as a newbie to this area?
Yeah.
If you were designing something that's not what you think of as an implementation science project, so say you were designing a feasibility study or something like that, I was just really struck by what you said before, which is more about impact and you know, actually things are about implementation if you don't necessarily think they are. Should you be thinking about implementation science techniques and learning even as part of, say, a feasibility study?
It's a great question. There's definitely a sort of time and a place where perhaps you just want to know if something's feasible, I guess. But there's this expression, I think it's something like pilots never fail, scale up never prevails, or something like that. I can't remember. But the pilots are always successful because we can control a lot of things, and it's just in one site, and you've got the research team on it. But then when you try and upscale it, it's really difficult to do. I guess I agree with you that we could do a lot of feasibility studies one after the other, show it's feasible, but it doesn't actually lead to any impact, because when we try and upscale these things, it just completely falls flat on its face. Even with simple things, like I often talk about, I've shown before, the surgical safety checklist. It's just a checklist that surgical teams are encouraged to use just to reduce post-surgical infections, which cause a lot of deaths every year. And we did some really great surgeon put it together. They did their RCTs in 8 sites, and it was effective. But then when it was rolled out across the world, it had a 1.5% compliance rate, I think. So even simple things just don't get implemented well. So yeah, I would certainly like to have a look at that. If you've got a study like that, I would have a look and think, well, while we're sort of looking at this, if this is feasible, could we also make this a little bit of a hybrid piece of work and just ask people what they think about this, and do they think it's a good idea, and what do you think is going to get in the way of this, and should we change things? So yeah, that I don't know. Does that answer your question? I know I can ramble, so I have to be careful. Cool. Well, yeah, like I say, any of you want to reach out, come to a drop-in session, or just have a chat with me, I'm happy to help. So yeah, any more questions? All right. Well, listen, I mean, it's been a nice group today, a bit small, small group, but I like that. It's nice to get to know you, and thanks for coming. So leave you to it. All right.